Hey guys, so I know nursing school doesn't really teach you much about IV insertion. So here are some of my tips. Tip number one, when you have your patient's arm, you're looking for a vein, palpate. If you can palpate and feel that vein, it's nice and bouncy, that's a good one. If you find a vein and it's very deep, you can't even feel it, I wouldn't go for that one. It's gonna be hard for you to get that sucker in. Secondly, when you are inserting the needle, before you even do that, make sure you're scrubbing the site nicely with an alcohol pad. That is going to kind of pop the vein up. Of course, it's going to clean the site, but it's going to pop that vein a bit with that motion of you scrubbing the area. If you can't find a vein, I suggest grabbing a warm blanket or a hot pack, wrapping that up around the patient's arm, and that is going to actually help open up the vein and make it a bit more bouncier so that you can see a nice vein to insert the IV into. If that doesn't work, go grab your vein finder. It's pretty good with finding superficial veins, but it won't really be helpful with any deeper veins. If those two don't work, go grab a senior nurse and she can help you out, she or he, sorry. Next tip, pull traction downwards. This is going to help stabilize the vein. Otherwise, when you insert, the vein might kind of roll around a little bit. So pull the traction down. I also like to hold up here above just to make sure it's nice and straight. Also, don't insert an IV into a vein that isn't straight. You're gonna have a trickier time moving that needle in and around it. So pick a straight vein, pull the traction down, insert your needle at a 15 to 30 degree angle, and once you see flashback, you're gonna wanna straighten that needle out, bring the needle a bit forward, and then start to thread the catheter up. You'll release the needle and you'll wanna hold down a bit above the insertion site so that the blood doesn't all come out at you. Another thing is that I like to always have a towel under my patient's hand in case they're on blood thinners and they end up bleeding so much during the whole experience. A towel is nice and helpful. It'll keep your patient's bed and their gown nice and clean. I hope those tips help out. Let me know if you guys want any more. There are 2 accounts that are really good for IV insertion tips. Listed them right here. Enjoy.